Gerokinesiology. Let us break down the word gerokinesiology. Gero is the root of the word gerontology, a study of old age and process of aging. Kinesiology is a study of movement or physical activity. So what is gerokinesiology? It's a study of how physical activity influences health and well-being in the older adult population and the aging process in general. So then, why is it a rapidly expanding area of a study? Our population is aging, and there are two major factors: aging baby boomers and longer lifespans. The study shows that by 2030, 1 in 5 Americans will be aged 65 or older. You see it in the graph for the population aged 65 and over. It's about 50 million today, but will rise up to 70 million in 2030. So for those extended years, how could we live a fulfilled quality life? I'd like to briefly share about the principles of whole person wellness. Whole person wellness, it represents the individual's multiple dimensions of positive beliefs and meaningful activities. This is not just for older adults, but applies to all of us. And the process and attainment are behavior specific. It's to find balance among various facets of life activity. It provides a broad framework for the integration of activities to enhance human functioning and quality of life. And it is to pursue individuals' effort and to be as healthy as possible in the areas of emotional, intellectual, physical, social, spiritual, and vocational health. So here are the 6 essential dimensions of wellness. This is called the whole person wellness wheel. Let's start with intellectual wellness. Intellectual wellness promotes the mind to think creatively and rationally. It encourages to expand knowledge and intelligence and processing information effectively. Social wellness. It promotes creating and maintaining healthy relationships with families, friends, and communities. Emotional wellness. It promotes an awareness and acceptance of one's feelings such as happiness, love, anger, and grief. Vocational wellness. It promotes the process of achieving positive personal and occupational goals and interests. Spiritual wellness. It promotes seeking meaning and purpose in life, develop a strong sense of personal values and ethics. And lastly, physical wellness. It promotes healthy lifestyle, physical activity and fitness, body composition and strength. And I would like to focus on the physical aspects of how our body system changes and the effect of physical activities on older adults and aging process. So let's talk a little more about aging. There are 2 types of aging, primary and secondary aging. The primary aging processes are universal age-related changes that are independent from disease or environmental influence. The examples would be hair loss, wrinkles, puberty, menopause, and loss of vision. The secondary aging refers to clinical symptoms and environmental effect and diseases. Examples would be cancer, cardiovascular disease, arthritis, obesity, and bone mineral density. We all change over time. Height approximately after age 40, it gradually declines approximately 3 to 4% by age 70. Our body fat increases due to increase in dietary intake, decrease in physical activity, and decrease in ability to mobilize fat. Also, our fat-free mass such as internal organs, bone, muscle, water, and connective tissue, they decrease due to decrease in muscle mass, increase in bone mineral loss, and decrease in physical activity. I would like to focus in depth on how physical activity affects our bones, muscles, brain, and to our balance and mobility in later years, and some tips for principles and recommendations for exercise. Physical activity helps with bone density and mobility. You should be performing weight-bearing endurance exercise such as walking, jogging, and hiking, and resistance exercise such as lifting weight, dumbbells, squats, and planks. But avoid exercise that involves excessive spinal flexion such as bending forward, twisting, and sudden movements. They could easily fracture or damage bones, especially for older adults. A vertebral fracture is a crush fracture and happens spontaneously, usually when lifting heavy objects. It causes pain, decrease in height, humpbacked posture, poor circulation, difficulty breathing, movement problems, depression, and more. Another very common fracture among older adults is hip fracture. Once you break your hip bone, over 50% never regain functional independence, and 20 to 30% die within 1 year due to medical complication. Our joint mobility decreases by 20 to 50% between the age of 30 to 70. It's affected by muscle, bone, and connective tissue. Men has greater decline than women. Greatest decline is in spinal flexibility, and it often leads to problem performing essential daily tasks, and eventually increases the possibility of joint or muscular injury, and increases falls from loss of balance and instability. The aging muscular system shows declines in most components. Our muscle mass declines. The number and size of muscle fibers declines, and more prominent loss in back and thighs. It loses up to 40% greater in sedentary individuals. The motor unit also declines. It decreases up to 50% by age 60. And also, reduced nerve conduction results in reduced reaction and movement time. Here's a picture of a comparison between 25-year-old and 65-year-old with similar BMI. There has been a lot of muscle mass loss with 65-year-old. Not only muscle components decline, but also in several parameters. Our muscular strength declines. The decline is greater in our lower body, an average of 20 to 40% lost by age of 70. Muscular power declines. You lose about 6 to 10% per decade. There is greater loss in power than strength in the aging process. Also, there's a decline in muscle capillary density. Muscle strength and endurance. Most decline in muscle integrity is due to inactivity, lack of exercise, genetics, disease, our diet, and stress. So let's see the functions of muscle system for homeostasis, meaning maintaining physiological processes. Movement. It makes adjustment to change conditions such as eliminate waste, exhale CO2, escape from danger, perform tasks of everyday living. It also helps move blood throughout our body. It gives support, such as maintaining posture and joint stability, prevent protrusions of organs, assist breathing, and circulate blood. Heat production. It's one of the main heat production within the body, especially contracting muscles during exercise. Benefits of muscle conditioning. It improves body composition, increases muscle size, reduces fat in and around muscle, increases metabolic rate, and reduces decline in growth hormone. It improves endocrine system, such as insulin sensitivity, and lowers blood glucose. It slows decline in all body systems, especially cardiovascular, skeletal, and respiratory. It improves muscle strength and bone density. Improves overall health, such as our posture, balance, appearance, reduces aches and pains, especially back pain, and reduces risk of injury. And it reduces risk of morbidity and mortality. It also helps maintaining ADLs, activities of daily living, such as personal care, housework, yard work, traveling, socializing, and hobbies and sports. It also helps maintain brain functions such as attention, memories, and executive functioning. Physical activity and brain. There are two types of links, simple and complex links. In simple links, physical activity helps increase blood flow to the brain and it gives mind-body benefits. In complex links, it helps neuroplasticity, meaning it changes the structure of the brain like plastic. It prevents primary neurologic disease, promotes healthy normal aging, and improves mood, improved thinking. Exercise improves memory skills, concentration, abstract reasoning, verbal fluency, fluid intelligence, and sensory motor performance. There has been a study that exercise helped improve in reaction time, short-term memory, memory recall, and eye-hand coordination. Exercise is needed to enhance cognitive performance. At least 120 minutes of moderate exercise or 60 minutes of vigorous exercise per week is recommended. Study shows that moderate to high intensity had equally beneficial effects on cognition. Physical activity also helps with depression. The more severe your condition is, the more helpful it is. It lowers anxiety and depressive symptoms, increase mood, self-esteem, and self-efficacy. It also increases opportunities for social engagement and interaction, and increase health-related quality of life. Good postural alignment, balance, and locomotor abilities are fundamental to independent living. It helps ability to perform activities of daily living and minimize the risk of falls. What's balance? It's the process by which we control the body's center of mass with respect to the base of support, whether it is stationary or moving. And what is mobility? It's the ability to move safely and independently from one place to another. Mobility is required for many activities of daily life, including transfers, walking or running, and other types of recreational activities. How does our gait change over time? Older adults' gait speed is 20% slower than younger adult speed. The stride length reduces and stride width increases for better stability. And there's an increased time in double support and reduce in arm swing and trunk rotation. Common risk factors of falling are weakness of muscle. If you had history of falls, deficits in gait and balance, visual deficits, use of assistive device, cognitive impairment, and also if you are over the age of 80, and numbers and types of medications you take, and depression. Fall prevention. Why is it an important issue? It's a leading cause of injury-related hospitalization. Fall is a cause of 95% of all hip fractures in seniors, 33% of individuals aged 65 to 79, and 50% of 80 years and older fall at least once a year. And among those falls, 70% of falls occur within and around the home. Falling can be prevented through routine fall risk assessment, exercise, environmental modification, medication withdrawal and management, get educated, and by using hip protectors. Let's share some exercise principles for seniors. Select exercise that simulate movements of everyday activities. Select activities need to challenge but not exceed individuals' capability. Perform exercise to the best of your abilities, but never push yourself to a point of overexertion, pain, or beyond level you consider safe. Here are some of the exercise recommendations. Conduct screening and assessment such as individuals' health questionnaires and health records. Set goals for muscle endurance, strength, power, and functional relevance. Exercise major muscle groups by using FIT principle. F for frequency, how often you exercise. I, intensity, how hard you exercise. T for time, how long you exercise. And T for type, what type of exercise you do. Exercise modifications and precautions. Discontinue exercises that causes pain. Modify exercises to avoid increasing pain. Warm up and cool down are essential. Resistant training is recommended. Emphasize smooth and repetitive motions. An intensity level should be below discomfort threshold. Be able to complete 8 to 10 repetitions per set with ease during resistant training. At least 120 minutes of moderate exercise or 60 minutes of vigorous exercise per week. And before I end the slideshow, I would like to share a basic posture which can relieve your neck pain and stiff shoulder. Please sit or stand straight. Open your chest and try to lower your shoulder as if you are pulling down your shoulder blades. Imagine you are extending your neck and tuck in your stomach. This will help you relieve neck and shoulder pain and help with turtleneck, as well as shoulder muscle cramps and stiffness, and digestion. Here's another technique which helps your overall health. Belly breathing, a diaphragmatic breathing. Most of you probably know that deep breathing is good for your body. Let's try it. As you slowly inhale, try not to move your shoulder and chest, but gradually expand your belly. Hold your breath for a few seconds. Then, exhale slowly with your mouth as you tuck in your belly. Repeat this whenever you have a minute. It will reduce your daily stresses, help with anxiety issues, lower your blood pressure, and much more. Thank you so much for your time.